Everybody for joining us today on this incredible panel conversation about the state of childcare in Santa Barbara County. My name is Holly Martinez. I'm the Executive Director of the California Commission on the Status of Women and Girls. And we are so proud and honored to be invited to join here today and to moderate today's conversation brought to you by the Santa Barbara County Women's Commission and the Office of Senator Limón, also Commissioner Limón, who is a part of our Women's Commission. So thank you. And I will start a little bit about introducing myself and a little bit about the work of the commission. As the executive director, we are a commission of 17 incredible women who represent the depth and breadth of the state and the diversity of our Californians. We advocate to the governor, the legislature, and to policymakers about issues related to women and girls and recommendations you can make in policy and program solutions. But to be effective champions in this work, we have to be relevant and we have to be compelling. We can no longer talk about women's issues as a moral obligation or expecting people to do the right thing to do. Because if the right decision were made in the first place, we wouldn't have some of the prevailing issues that we experience for women across the state. Instead, our work at the commission has been about reframing the conversation around women and ensuring that the representation of our challenges and our roles and our contributions are brought to light as more than half of California's population, because we know women are essential to California's future. At the commission, we recently published a blueprint, the California Blueprint for Women's Pandemic Economic Recovery. And what we learned is that women who were caring for our loved ones, keeping hospitals open, educating our kids, while all adding to the burden of their household, are the essential ones to keep all of these functions going. Yet they experienced larger share of job loss across the nation in female-dominated occupations like childcare and elder care. And in fact, it makes this conversation so much more relevant today to talk about what is the longstanding issue of childcare. How do we think about creative and innovative solutions to support future ability for our care workers and our children to thrive? Which is why I'm so excited we have such an amazing group of panelists here to talk a little bit more about the solutions that they are bringing forward. One of the important pieces of information shared about Santa Barbara County when it comes to the state of early childhood education and needs, I was astonished to learn that 849 children were without access to childcare, and that majority, 568 preschoolers went without care due to staffing shortages. It's not a surprise that staffing shortage among caregivers is an issue, with women experiencing higher rates of burnout and issues of making a living wage in order to provide for their own families and as well as stay in the care sector. So with us today, I am very excited to introduce a set of panelists. We have Wendy Sims Moten, who is the Santa Barbara County First Five Executive Director. We have Elizabeth Riso, who is the Director of the Orphelia Early Learning Center, and Dr. Gabriela Garcia, Executive Director of Storyteller Children's Center. And of course, with us is Senator Monique Limón, representing Santa Barbara County and parts of Ventura County with us today. So I will start, thank you everyone for joining us. I will start with the first question that I'd like each panelist to answer. But starting maybe with you, Senator Limón, if you could just take a moment to talk a little bit about your background related to childcare in Santa Barbara and what you're doing to contribute to the state of childcare in the county, its improvements, your perspective and your view, maybe especially as a newer mother who's, as you'd mentioned, having to balance the challenge of being a senator, running back and forth between Santa Barbara and Sacramento. We'd really love for you to share your perspective and your thoughts on this massive topic.
Well, thank you so much, Holly. And really, I think my perspective is limited compared to some of the panelists, but certainly as a new mom with a toddler, the child care challenges and complications, but also potential opportunities are not only known to me, I think, from a policy perspective in the work that I do, but they're known very intimately in our household. And there is a discussion about childcare on a regular basis. And so certainly combining the policy work that I do around childcare and have been doing for now 7 years, right, in the state legislature, combined with being a mom, gives you kind of a double perspective on what is needed and what we're thinking. The Legislative Women's Caucus in the California legislature is a bipartisan caucus with 50 members, and childcare has always been a priority for us here in the state of California. There is no doubt. We are the caucus that has every year come to every governor for well over 2 decades saying this has to be a priority. And I think what happened with the pandemic is that it went from really being categorized as a women's issue to being an economic issue. During the pandemic, every economist that came and spoke to California legislators essentially said 2 things will never happen if you want a healthy, 2 things must happen in order if you want a healthy economy, and that's schools must reopen and you have to have childcare. Without these 2 things, without one of them, the economy just does not work in the way it should. And I think that once this happened, you started to see a little bit more momentum at the state level for multiple things. One, to really think about the labor force. And secondly, to increase the number of childcare spots in our states that are subsidized. Now, we did that. There's a lot of enthusiasm and there's been some challenges. You just like I talk about childcare and the economy go together, labor and childcare spots and facilities go together. When there's issues on one, the other is impacted. Certainly years ago, I passed a then Assembly Bill 380 to really think about a childcare workforce and what it would take to professionalize and bring this workforce to the negotiating table. And so that was something that we did. We know that childcare workers in this state are predominantly women and predominantly women of color. So these are issues that we continue to see at the state level. I think we're in a challenging year in 2023 where we were so incredibly happy that we increased our childcare spots in the state of California by 200,000 over a period of a couple of years. However, without the labor force, we haven't actually been able to fulfill our promise on those 200,000 childcare spots. And we know that when someone that works in the childcare space can go to a fast food restaurant and get paid more per hour than what they would be paid in the childcare space, it's going to continue to be an issue. So this is where I think our state and our country grapples with a huge indiscrepancy. You need childcare in order for the economy to function, and we value childcare at a different level as an entity that's needed for the economy to function. So I think that that's where we continue to struggle. And so this year, I'm continuing to work on these childcare issues as it relates to rate reform in the labor force and also family fees.
Thank you. I know I had read at one point that the Washington Post likened childcare to making less than what an average hourly rate of a dog walker would make. And that just really shocked me. It was astonishing to see what are we placing on the values of women who are performing, and like you had said, Senator, women of color who are performing some of the most important jobs of raising and caring and for our children. And it does beg the question, what types of reforms? And you had mentioned several. But Elizabeth, tell us a little bit about your perspective and what you're seeing and your efforts on trying to transform childcare in California. Oh, you're on mute. Oh, let's see. Oh, Elizabeth, you're on mute.
Thank you, Holly.
Okay, thank you.
I started with, I support Senator Limon's comments and looking at the totality of what's happening in the state of California about the increase in the spaces, especially for 4-year-olds, that has happened, and yet the labor force is not there. So our facility, Orfalea Early Learning Center, is also the Early Childhood Education Lab School. So we have a dual purpose. We provide childcare for Santa Barbara City College students, faculty, and staff, as well as provide a lab opportunity for students enrolled in the Early Childhood Education program. So we're part of the Strong Workforce Initiative, supporting the the CTE programs, career technical education programs. So we support the labor portion of not the labor portion, but provide opportunities for students to become teachers or enter the labor force. And we've seen more of this, although we see more not entering the labor force right away, but going on to get their bachelor's degree. So it's the early childhood education portion is, again, when you look at being able to make more money at a fast food restaurant or a clothing store as such, that's kind of how they offset their ability to work full-time or go to school full-time and also sustain their living in Santa Barbara County. So it's a quandary that we continue to be in. And I'm not really sure what all the answers are. It's continuing to support early childhood education is what I believe.
Dr. Gabriela Garcia, any thoughts here?
Sure. Hi. Thank you so much for having me. I am the executive director at Storyteller Children's Center, and we serve children 18 months to 5 years of age who have significant ACEs, adverse childhood experiences. So we teach through a trauma-informed lens and focus on the social and emotional development and learning, as well as the academic learning, so that when students enter the school system, they're ready to learn on par with their peers. And we have seen, to echo Senator Limon's thoughts and input on this issue, we've seen this time and time again, right? You can't break the cycle if you don't have people to work, but if you don't have childcare, how are people going to work? So it's this continuous cycle that we are unable to break. And in terms of the historically lower paying wages in this field, individually as an organization, that's something that we've been really focused on, not perpetuating the cycle of poverty and trauma. And we have, and are very fortunate to have redone and completely revamped our salary matrix. So now we're very proud to say that our teachers are earning a starting rate of $25 an hour. And we hope that in the future that can go up even further, and of course dependent upon experience, and they would be placed in a higher bracket. But we are really trying to drive the interest in coming into this field because it is so needed for our economy and our families. There are very limited spots in Santa Barbara County for childcare and affordable childcare. And I have only been at Storyteller since July. I was previously on the other end of the age spectrum, working in gerontology. And as myself, like Senator Limón, we both have COVID babies. My son will be 2.5 next month, first-time mom to a toddler, and experiencing what childcare is like in Santa Barbara as a first-time mom, a working mom, a professional, was astounding. I don't know if we wouldn't have gotten really lucky, what we would have done, and how I would have continued to, be a mother and a full-time career person. So it's definitely something that we are really looking at, and also creating programs within our organization to support people in terms of recruitment and finding, new ways to get people engaged and wanting to go into the early childhood education field. We know, and I say this all the time, 90% of a child's brain is developed by the time they are 5. That is huge. These are the important years. And if as a society, we are not focused on this age group, we will pay the price down the line. And so the time is now in our young children's lives so that they can go on to be great contributors to our community.
Thank you, Dr. Garcia. I think you mentioned just the work that you guys are doing to sort of incentivize people staying in this care industry. And I want to kick this back to Senator Limón really quick, because a couple questions came in on the chat here, wanting to know kind of, are there efforts underway to try to change and incentivize the care industry? Sort of, are there any bills? Are you running any policy?
Oh, there are definitely bills. Actually, the California Legislative Women's Caucus just supported a bill that I am carrying, as well as Assemblymember Eloise Reyes. And so one that is rate reform. And so what the state and how the state pays for some of our contract work as it relates to childcare, and reforming that rate so that we can increase it. And then secondly is the childcare family fees. So I would say that those are probably among the biggest things that are being done for both the labor force and kind of the immediate subsidy for our families in needs. We are in the middle of negotiating the state budget. So the May revise is coming out in a few weeks. And we will have a June 15th, at least a skeleton of a budget by June 15th. And we are really having conversations about those 200 spots. I don't know if people followed, but in the January proposal that the governor put out, there was some drawing back of those 200 spots because they weren't being used. And so the problem with the 200,000 spots that aren't being used is that you need a labor force for them. And so these things go hand in hand. So the Women's Caucus will certainly ensure that we fight to keep as many of the spots that are being paused. They're not being cut, they're being paused, as well as spots, rate reform, subsidies. We're all really looking at this. And I agree that this issue is one that hits 58 counties. I think those in Santa Barbara County, and the discussion really is about Santa Barbara County, but I don't know any county, no legislator, man or woman, Democrat or Republican, who says that there is enough quality childcare in their district. I've not heard that. It's not something that we've seen. This type of work has quite a bit of bipartisan support, and where it falls in the priority is usually where it gets caught up. How do we prioritize it? How do we put money into it? And so that will be part of the discussion. It's a tougher budget year for California this year. It's certainly not what 2022 was, but nonetheless, I think that there's a lot of legislators who are committed to raising this issue, these issues on a year-to-year basis, because one year we will win. 1 year we're going to get a win on these issues, but if they're not raised, we certainly don't get that.
And cheers to that. And I know at the commission, we're really supportive of these policies and want to continue to champion. And I think conversations like today bring to light so much of the need. And you're right, it is being echoed across every local commission that we are hearing from, and counties across the state. Wendy, tell us a little bit about your work. Dr. Garcia talks about how the first 5 years a brain, is the most important time for the brain to develop, and your work at First 5. Tell us a little bit about that and your thoughts on this whole sort of labor force shortage and what we can do.
Yes, thank you. Thank you. I'm so privileged and honored to be here on this panel with these wonderful women. And this discussion is so dear to my heart. I've been with First 5 Prop 10 that was enacted in 1998. We are now 25 years old, and we are still talking about these things. And at 25 years ago, there was actually money funded to make sure that across all 58 counties that we could focus on that early brain development, focus dollars, focus time, intention. and to look at the whole care of our children, starting with those early years, how critical they are to those later years. And also being a school board trustee, I understand when we don't focus on those early years, how it impacts those later years of the students that we see coming into the districts, into the schools. I absolutely think I do want to say something that, they get me a little bit of trouble, but I just feel so passionate about the fact that the care and education of our children should be an entitlement. It should not be discussed. We should not have to worry about it when. We need to set it aside and make sure it's untouchable. The care in the care and education of our children should be untouchable. No matter what we're doing, figure out how we're going to do it, but it should be untouchable. And then we're not still here now, 25 years later at the First Five, after First Five was enacted, still talking about this in terms of those pieces. So how do we really start to do that again? Because childcare has always been a need. The care for our children has always been a need. But we've also fought against babysitting. And anybody knows that you got a child, you are not sitting at all. You are moving. There's so many things that involved in that. I remember way back when I was, I say way back, but when I was 12 years old, it was considered babysitting. So say it's perceptions. I think also that you have to change too, to look at that. So to get people looking at, yes, this is an industry that we must professionalize. We must make sure they have the absolute training that they need to do that, and the training that is going out, and they must be paid for that. It is no different from any of the other industries that get the necessary training and the personal development that it takes to make sure, because when you're caring for those young children, you're nurturing those first years, and then at the end, you're figuring out, as you get into those later years, that you have influenced their growth at the most earliest times. And so we must professionalize this in a way that we're not having to defend it. It's always been a need. We need to change our perception of it. And if COVID did nothing else, it said it's not a woman problem. It's everybody's problem. It really happened in terms of like when COVID shut down and the care of our children went up into flux of what was going to happen, it was like the air just got sucked out. What are we going to do? So if COVID did many things, but it said it elevated what we've been talking about for years about this, and it's the time is now. So I appreciate Senator Limon's pushing it forward, the women's caucus pushing it forward, but I don't. What do I need to do? Is there a bill that says it has to be entitled? To go out that it's an entitlement. I hear about entitlements all the time. I think this certainly should be one of those. So as you can tell, I'm very passionate about that, and I feel I'm in the right place at the right time. I think that's really critical too, so that we can lay the foundation going forward that the care and the education of our children is paramount.
Thank you, Wendy. I think you said that so eloquently. And I think what you hit on is the idea that this is not a moral argument. This is, you said entitlement. Well, often when I hear that, people think, okay, well, what is the cost? So how, this is open to any of the panelists. How do we transition this issue that is often seen as a women's issue into an everybody's problem and a larger problem as it relates to the economic impact if we don't get women back into the workforce at a rate? One interesting statistic that we had found at the commission is that the care sector, unsurprisingly, is not recovering at the rate of other sectors. And it's about 11 percentage points behind any other industry. So what does that tell us about our ability to keep up with demand and pace and allow for women to return to the workforce and ensure that children have affordable, accessible care? So how do we turn this into an economic argument? How do we make this seen as a necessity and a requirement for the future of our state? Any thoughts?
Can I just add one to that? Thank you for that. The cost, if you will, there's going to be a mental cost. There already is a mental cost to this if we don't pay attention. Yes, there's an economic cost. There's always a cost to something. But more importantly, there's a mental cost to what's happening, in terms of how the care of our children, the education of our children is being impacted. So when we look at that, and we look at the juvenile crime rates that's going on, we look at the child, abuse rates, we look at all of those things, there is a mental cost and there's a physical cost as well. If nothing else, those are the two things I think is really important. There's a mental and there's a physical cost if we don't make this a priority.
Well said.
And I think I'm sorry, Holly, I think it goes back to what Gabriela was saying about her work with ACEs, but the social emotional development of our young children. the more we invest in providing quality care and opportunities to build on their social emotional development strengthens a foundation that is linked to mental health and mental well-being, not only for the child, but for the family. So seeing childcare and valuing early childhood education as an entitlement, as you said, Wendy, or as critical to the economic structure of California's workforce, it is beyond just women's work. It's all our work. What we invest in childcare right now, and I look at it from the earliest years, from infancy. I'm looking at it from infancy to the age 8. Those are the critical years, and there is where the gaps are. You stated, Holly, how many preschoolers are not having access to childcare. I also consider how many infant and toddler, which Gabriella and Monique both spoke to, how many infants and toddlers are not receiving quality care, or what is the number? I know the number is not being met. So contributing to the workforce, supporting our career technical education programs, making sure we're building our workforce. I think those all go hand in hand. I think COVID did bring early childhood education or childcare as an essential need. And now it's kind of like, well, we're back to where we were, and it's kind of been shuffled back down to the bottom. So I just wanted to share that.
I think, Beth, that you bring up a really great point in sharing that we have to focus on parents too, right? Partner with parents as a child's first teacher or teachers, their families, right? That is where we have to also focus our efforts on in terms of education, in terms of helping them, create an environment with stability and centered around, important learning for their children. And, we're at Storyteller, we're really glad that we are able to do that. But a lot of, other places might not have the resources to do that. And I think that's really important too, is you don't know what you don't know. And as a parent, if you're not sure how to maximize what they're learning at, in preschool or daycare, how are we going to continue that? Because we can't do it on our own, right? So focusing on that end as well, I think is really important. But it's been, seeing it time and time again with, some of our students who don't have, a secure place to live and grow, that, really inhibits. So it's a lot of issues that come down to this, the issue that we are seeing in our county with affordable housing. And even so, not just affecting the low income, but the moderate income families as well, the working people, right? And so it's definitely something that has to change. Otherwise, who's going to live in our county?
Yeah. And I will just add that from an economic issue, to me, the correlation is so direct. When I talk to any, labor force at this moment, any sector, they're talking about worker retention, about jobs. People can't go to a job. They can't stay in a job if they don't have childcare and they have childcare needs. That's simple. So when people ask me, what's the economics? I'm like, jobs. This is about jobs, right? And so to me, that connection between the economics and childcare is super, super key. And I think when it comes to the development of the children, look, first of all, I need everyone who's listening and watching to know that these 3 women are among the best and most qualified and knowledgeable and thought leaders in this particular space in our whole country and region. So my hats go off to them. But I can tell you that even, taking my state senator hat off and only wearing my mom hat at the moment, the second that my daughter got into quality childcare, every milestone that I thought maybe she was hitting, but not totally hitting, she hit so fast. So I watched how fast a child gains fine motor, large motor, verbal, right? Like every developmental issue, or milestone is hit in a very, very fast, different ways. So even for people who have, some education, some background, a stable job, a stable home, that you would think could maybe pull it together. Look, it turns out that like quality childcare does so much for that brain, for that body. I mean, all of it. And you're also able to detect, hey, we might need a little more intervention or support here. So I think that you have both the economic and also, the economic in terms of the jobs, but you also have the economic in terms of how we invest in humans in the short run and in the long run. And I think that the early intervention, to me, I have lived it. It is in my blood. So whether I'm wearing my state senator hat on, or whether, I'm just, a mom like everybody else who's trying to figure out how to piece this together, who knows what it's like to be on wait list, who knows what it's like to go to family, to go to friends, to try to piece it together when things aren't working and imperfections happen in our everyday lives. I get that piece, but it's so critical to understand that when we talk about how we develop an economy, yes, we can have the jobs conversation, but the human investment conversation has to happen simultaneously. And that's what quality child care gets the community and our society.
Yeah, can I just add to two of those points that have been made? Talking about not being able to go to work if you don't have childcare, then that's where we perhaps, how do we collaborate with employee-sponsored childcare? How do we collaborate with that? How do we make what that looks like? So they are there. Children, you're able to take them where you're going, because a lot of times, even during COVID, we were having to make sure that we had childcare for our first responders. And you're putting in it. One thing children need is stability and consistency. And so having them go to somewhere different was, difficult. And parents were struggling with that as well. And so if we can work and be more collaborative about employee-sponsored childcare, it's there. That's economics as well. You have the mental attention there, because I know where my child is and all those different things there. And the other thing too I think there's an untapped or really underestimated the strength of family, friend, and neighbor, because oftentimes childcare is highly unaffordable as we're talking about that. But how do we support the reality of that? They may have to be at a friend, a family, and a neighbor. So how do we do that to give them the resources? Some of the things that First Five does is said, we can give you the resources, not in a judgment way, but how do we support you? Not saying that you should have this, but we know those things are there. And then I think what's important too is asking, what do you need? How can we best support you as a parent, as a caregiver of this child? What do you need? And so oftentimes as funders, we tell you because we know from an academic standpoint what should be there, but that doesn't always meet with reality. So it's important for us to ask, what do you need and how can we support you so that when your child is ready to go and you're looking at those developmental milestones, you kind of have the resources to kind of give you a guide and where you might need to reach out and, for additional assistance in there. So I think employee, assistance, employee-sponsored childcare would go a long way to do that in increasing the common. And then that also impacts women. Well, we're in the workforce, but we can't be there if we don't have the childcare. And how do we really, the family, friend, and neighbor, how do we do that? Those who are caring for children, because with COVID, they still had to go to work and they didn't have childcare. So there may be 4 or 5 kids somewhere that they hadn't done. So how do we support those environments as well?
And I think to add to that, the issue of making sure that there's accessible childcare all day, right? For the 9 to 5 people who work, that's huge too. Because we see so many who are only available till half day or 3, but how are people supposed to then to work and keep up, their jobs without putting their positions in jeopardy for being gone?
Yeah, I just add that. Can you just tell them just want to do this, excited about this? We talk about in our Northern County, we have largely agricultural companies. There are different, hours. I need to go to work in the fields. I need to go different hours. And so how do we make sure that, again, that the children are taken care of? And what does that need? Transportation. So that various needs, even in the communities, the various needs may be different, in terms of the hours of the childcare, earlier, longer days, such as Dr. Garcia is just saying. So there's so many things that this is such a complex thing, but it is such a crucial thing that we figure out and make sure. I think we have different things going around, and really everybody's trying to address it, but how do we bring all those things together? I know there are bills going around about giving tax incentive to employers, but how do we put that in the umbrella of the care and education of our children? How do we put that together as an entitlement? Let me just add that back in there. Yeah.
Well, I know on the Assembly side, Commissioner Rebecca Bauer-Cahan has introduced a bill that would sort of spark the conversation around how do we create tax incentives for businesses to create care on site or provide some sort of care stipend support for their employees. And I think it does take a lot of these sort of creative conversations as well to understand all the many faceted ways we can think about these opportunities. Support a system that has been, quite frankly, broken. It wasn't built for working mothers or families to really thrive. And when I see statistics in Santa Barbara County, like 26 childcare sites have been closed since October of last year, 28 classrooms have closed down. How do we recoup? And I keep thinking about, Dr. Garcia, your comments about also sort of trauma-based interventions. And to your point, Senator Limón, these facilities also understand how to provide specialty services at a time where we as women often figure out how to cobble it all together. But why do we have to figure it all out all the time? We know women's mental health and the burden and the burnout is real. So it is not just the future health and human investment, which is so right, of our little ones. It's also how do we also support each other and ourselves and all of the many burdens that we are struggling with every day just to get the kids to school on time and make sure the lunches are healthy. And did I make that meeting? And am I ready for the Zoom call? And all, et cetera, et cetera, et cetera. So I'd love your thoughts on that whole compounding problem that we know women more so are experiencing today.
Well, it's interesting, Holly, that you brought that up. I was thinking as Gabriella and Wendy were both talking about mental health, it's also looking at the mental health of our teachers and our childcare providers. We often talk about children's mental health or families' mental health. It's also looking at making sure that we're not watching for, but we're aware of the burnout, signals, or how do we appreciate or how do we acknowledge the work that they're doing? And they're also juggling just what you said, Holly, all their family struggles or challenges around, is it childcare or is it getting to the bus on time or is their child sick? So it's economic on so many levels, or impacts economics on so many levels, but the labor force and really making sure we're taking care of our teachers is also an important component of looking at this from an economic standpoint.
That's a great point, Beth, because if, one of our teachers who are also struggling with, or juggling being a mother, having a family and working, how do we give them the opportunity to deal with what they need to deal with? Say if their child gets sick in the middle of the day and they have to go, right? Then if we don't have enough of a workforce, enough teachers to fill the ratios that we have to meet, what does that mean? Does that mean that then we need to emergency shut down a classroom and all of the other parents need to come pick up their child because now we're not meeting ratio? And there is just so many things. So I think understanding the in-depth, struggles that we face as providers in terms of all of those things like ratio and numbers, that is really important too, because it makes a huge impact.
Yeah, and I would just add that I want to acknowledge that the work that's been done, all the historical work that's getting us even to this point and getting us, continue to elevate this need that's still here in the struggle. I think as we, do an assessment, if you will, in terms of all things that are going for childcare, where are we and where do we fill those gaps? In terms as we're looking at what's the workforce, how is it being reinforced on that? How is the mental health? Because the world has shifted, it has shifted. And we need to acknowledge that it has shifted. And so we need to address things in a different way. When we had to do what we had to do, we were forced to do it in COVID. So it also said that we can do it. So that this is an opportunity to look at that. So I want to recognize and acknowledge those who've been in the struggle about this, and as leaders, as budget, as assembly, and all the political leaders, how we start to look at that, acknowledge that the work it is and the complexity that it takes to get this work done. But having done what we needed to do when we were forced to do it, we know that we can do it. So we should always look at it as well.
We can do it. Now we just need to get paid for it, right? Thank you, essential workers. Don't thank us, pay us, right? The nurses, the teachers, the childcare workers, all the people with burnout that we're talking about. And so I think I love hearing some of these solutions and some of these ideas. A really interesting question came in on the chat that I like to pull up here. And someone asked, can the state assist with the development or acquisition of facilities or modifications to facilities as a way to lower costs and increase access to locations for licensed center-based care? Because we know so many access the child care deserts. I'm not as familiar with Santa Barbara if those exist, where there's not enough access to safe and affordable child care centers itself, or if it's more of a labor force question. I'm curious if anybody knows sort of the access issues for Santa Barbans.
I think it's both.
Yeah.
I think it's having access or the availability, it's the accessibility, affordability, and the labor force. As Gabriella just mentioned, is meeting the ratios, which I feel are very important to do, but at the same time support the labor force of, yes, you can build or figure out how to support the growth of facilities, yet you still need the labor force. So it's building the labor force and then the facilities, or if you build it, they will come,
Yeah. I feel like
I'm not sure.
I feel like in Santa Barbara, we're also so strapped for land that, if there are available buildings, how do we, the issue is like, how do we bring them up to licensing code in order to pass? But, I think where it comes in is, Beth is right. How is it the chicken before the egg? Or also, where's the hen house going to be? Because we are so strapped in Santa Barbara for buildings.
And I will add to that, because I think that this kind of dilemma is that, that's been raised about which comes first, the labor or the facility, is also a conversation that has come at the state level, and certainly it's a conversation that's been in discussion. I am going to tell you that at our state capitol, the belief is that labor has to come first, because we have had so many childcare facilities close since the pandemic. The state has not identified that the number one issue is the facilities. There are facilities that are ready now, that have been ready. There are classrooms that are being shut. So the facility may still be open, but they could potentially open up another classroom. But we have to work on the labor first. So I think that there's not a right or wrong answer to this. It's, what's gotten us to the point of saying we got to focus on the labor at this moment is just the out of dire necessity. And so I think we've watched what's happened. I think both need to happen. Look, it's not that we want to put two compelling interest to compete against each other. It's just where we're at in the moment. And so we'll still continue to have those conversations. Certainly one of the bills that, I'm carrying is a bill related to trying to facilitate for some of our businesses to get a credit. If they're able to open a childcare facility, but that is not going to solve it. You can't open a childcare facility if you don't have labor, and the labor need is so extensive now that the state is really looking at how we try to do that. So the bill that I have that's working with some of the businesses, the private businesses to try to do this is Senate Bill 533, and so that is one of the bills. But like I said, right now the focus is on what are we going to do about the labor piece. And that's just the state. I mean, the region could have a different focus, but that's really where the state's at.
So then does it go back to how do we incentivize going into this field, going into the ECE space, taking classes, and, developing that way? Like how do we make that an incentive? Or, it's hard work. It's not, this super lucrative field. And that's why we've seen, a decrease in teachers everywhere. But how do we incentivize that and share even at the high school level before, kids are making a decision in what field to go, and teaching them about the importance of early education and how this truly does lend to the future of our economies. So it's, I don't have the answer for that.
Yeah, I would add to that, right now that, we're getting or will be fully implemented TK, how that's impacting the schools in terms of that. Also, again, the pay at this level is people who we've supported, advocated for, make sure we nurture that they get their BA degrees, because that's a higher quality childcare setting. And then now we have TK, so people are going there because they have the teachers there, because you just can't adapt the curriculum. It's a special thing that needs to happen. And so the early years are losing those teachers there that we built up to the point where they are. And so how do we talk about that? We certainly wanted to make sure that transitional kindergarten was universal, but then we have an unintended consequence here, both of facilities on the K through 12 side, TK through 12 side, as well as the loss of the labor here. But the incentive is to pay, know your worth, and then add taxes on top of that. So just in terms of how we do that. So we start to look at that when we're making those decisions, when we're pulling those bills, where is that unintended consequence that may happen as a result of that?
Mm-hmm. Yeah. And with TK, it does open up the opportunity for us to serve more children at a younger age. However, then, we also will have to revamp our facilities to meet the younger age to pass licensing. So the funding for that is going to be really important in the next few years, as we reach a full capacity of TK.
Yeah. And look, I think the idea of expanding TK is a great ideal to strive for, from my perspective. But there are 34 school districts in the Senate district that I represent. And there are 34 different ways that school districts are running TK at the moment. And so I think that that's one of the challenges that we're facing as this implementation and rollout is happening. And so for families, it's really difficult, right? Like I see, on some of like the group parent chats that I'm on, people comparing district to district, school to school, which TK model gets out at 12:30, which TK model has after school care. The list just goes on, the facilities, right? And so I think, with time, I hope that there will be a different type of standardization for what TK is. I think that maybe doesn't exist at the moment. But I also feel that there are more generally slots and opportunities for kids who are 4 than the infant. Infants and toddlers is like hard to find and definitely more expensive. So I think, that's really, really important to keep in mind, that there's a lot of focus on the 3s, the 4-year-olds, for a variety of reasons. The ratios, change also and allow for different people to consider it 3 or 4, but there still is a really, really great need specifically for infant and toddler. And that's the hardest to find in our state, not just in our county. It is the hardest to find and it is the most expensive. Yeah,
I think the statistic is that 30 to 50% of a family's income goes to pay for childcare. And that's huge, especially, living in a county that is 118% more than the national average. It's significant.
That is astonishing. So much of everyone's hard-earned dollars are going right back out the door for childcare. And I think families who need to make a living wage to provide for their families are often, we know so many people who are stuck between, do I work or do I stay home? Because I can't afford to do both. And that is a dilemma I think we are all collectively working on. I do want to do a quick time check. I'd love to be able to just pause here for a moment because there have been a number of incredible representatives joining us on today's call that I want to give a shout out. And then I'll go around to each of you to kind of give your sort of closing statement in a moment here. But I just want to give a shout out to Esmeralda Estrada on behalf of Congressman Kabahar, Angeli Levine on behalf of Assemblymember Hart, Supervisor Laura Capps, Katie McShirley on behalf of Supervisor Doss William, Santa Maria Council Member Gloria Soto, Goleta Council Member James Cariaco, Santa Barbara City Council Member Oscar Gutierrez, Carpinteria School Board Member Jamie Diamond. Thank you guys so much for listening in on this conversation. We hope that you all will continue to participate in these important discussion points and solutions that many of these incredible women are bringing to the forefront. So with that, in your closing remarks, I'd love to go around for each of you and say, what are your final thoughts? Are you hopeful? Do you think solutions are there? And what call to action might you have for everybody listening here today? And I'm going to start with Wendy.
Thank you. Usually hope and fear. Okay, maybe you're going to go somebody else. My fear, you're going to come to me first.
All you.
Thank you so much. I have surely enjoyed this time today spending with these women and talking about this very crucial and very important topic that we continue to have. And so thank you for the time today. I'm always hopeful. Because anytime that we're up and still talking about that, there's always hope, and know that we're still committed to working a solution. And we understand how important it is, and it's taking more and more to be able to afford childcare. So we have to continue to work with that. And then I'll just end with my call to action that the care and education of children should be an entitlement that's untouchable.
Thank you. Dr. Garcia.
Yes, thank you so much for having us to have this conversation and to continue the conversation, right? This shouldn't stop here. So I think my call to action would be for funders who are so generously funding our programs, consider not restricting those funds. Oftentimes they're so restrictive to very specific things, but trusting us to use those dollars to the best of our ability for students and their families will go such a long way. And so that is my call to action. But I think that this conversation, of course, needs to continue. And I hope that we can do that on the local level, Beth and Wendy, and keep meeting so that we can remain hopeful. And thank you so much, Senator Limón and Holly, for having us, and everyone else who helped to put this together, because bringing the attention to it will make a difference, right? And I know that Senator Limón will take this to the state level and help us really transform what this space has been. So thank you.
Thank you. Elizabeth, please share.
Thank you, Holly, for facilitating, and thank you, Senator Limón, for putting this together, and your team. I agree with Wendy and with Gabriela. I always have hope. There's always hope. The pendulum, I've been in the field for over 40 years, and the pendulum goes one way and then swings back and then finds balance. And I think just having a conversation, Senator Limón bringing us together just to have a conversation about this important topic. I think what I want to close with is the investment of the children we provide today are the children who are going to be caring for us in the future. And I think it's a really strong point to think about is the mental health and the entitlement and the continued conversation of just supporting our facilities. And I really want to touch, Gabriela, you bring a great point of restrictive funds. It's trusting us to know how to utilize those funds and create best practices. So yes, thank you again.
If I may, I would like to share this quote that we've been using a lot at Storyteller, and it was shared by JFK, and it says, "Children are the world's most valuable resource and its best hope for the future." And I think that speaks volumes to what we are trying to accomplish in this space, because, you know, it will come back around and benefit.
Thank you. Finally, Senator Limón, who always leads by example and leads amazing work for Santa Barbara County in representing all of the efforts. And please share your closing remarks.
Thank you. I want to thank the Santa Barbara County Women's Commission for really putting this together and ensuring that this is a conversation we have at the forefront, where we're public, that we're, you know, engaging in this. And our, you know, Holly, you lead our state women, you know, Commission on the Status of Women. And so I feel like it's so important because women continue to lead in this space, although it's an economic issue and not just a women's issue, right? So here you have women leading economic issues, conversations, and I think it's so critical. I think whatever we all can do in terms of our own work, our own discussion, our own input in how we talk about this issue, and moving it from just a mom's problem to an economic problem for our state, I think is really, really, really critical. We do have legislation, you know, that's been shared in this particular chat about what's going through. We have childcare, you know, rate reform. We have family fees. We have, you know, incentives for businesses. I mean, the list goes on in terms of where we're following and what you can follow. And you can always contact our office for more information on what legislative priorities are coming out of our state related to childcare. I agree with Wendy. We are not done advocating. We are not done doing this work until it is an entitlement, until it is something that is in our budget, and we are not fighting for pieces of it year to year and fighting to sustain it. So I think we have a lot more work to do. I think Santa Barbara County and, you know, our region is just so lucky to have these incredible thought leaders. Like, I have to tell you that between Wendy, Gabriela, and Beth, you know, these are all women who I've had multiple conversations with, who know me as a professional, who also know me as a mom. You know, I learned right away as I was pregnant, I needed to talk, I needed to read, and I needed to sing to the child. And it works. It works. Right? I mean, all of these things that I've learned from people who are thought leaders. And that's part of bringing this community. And I'm so grateful to the commission for doing this work. It is about ensuring that our community has access to resources, that we bring the experts together and not believe that everyone has to be an expert on every issue, but that we have access to the people who know how to help us do this. The investment is about investing in this, you know, in this policy area, in childcare, but it's also about investing in humans. I love that quote, that this is, you know, children are the ones who are going to take care of us, and the investments we make now will yield a return when we need care for ourselves. So thank you all for participating, and so incredibly grateful again to the Santa Barbara County Women's Commission, to our Commission on the Status of Women, for never letting down on the fact that we have to have these public conversations with our community.
Well, thank you so much for those wonderful words. Great way to close. We are 5:01, ladies. Thank you, everybody who joined this conversation. Shout out to Jordy and the Women's Commission in Santa Barbara and everybody who supported this. Hope everyone has a wonderful evening. Thank you.
Thank you.
Thank you.
Bye. Thank you.